Hi, I'm Judy Thomas, Director of Contracted Services at Community Pharmacy Wales. My instinct at the beginning of the crisis was to help, and I did that by returning to work as a volunteer on several Saturdays as a pharmacist in my former branch of Rowlands in Conway. It was here that I witnessed the immense pressure that community pharmacies have been exposed to since the start of the pandemic. I saw firsthand the hard work delivered by the network with the significant increases not just in prescription volume but also in queries, as community pharmacies were the only primary care contractor easily accessible to patients and the phones rang constantly. Behind the scenes, Community Pharmacy Wales has endeavoured to support contractors in any way we can during the crisis. We've had rapid discussions with Welsh Government and health boards and agreed on necessary contract changes to release capacity. We've increased our communication with the network to ensure that vital contractual information is being relayed. We've been raising the awareness of the challenges faced and not least the appalling verbal abuse and in some cases violence experienced by colleagues. We've worked with the RPS and politicians to raise awareness of this. From the beginning of the crisis, we have been highlighting the need for PPE and the requirement for community pharmacy teams to be acknowledged both as key workers and as an integral part of the NHS. So, on to the topic of luggage, things we would want to continue and to take forward. We'd want to see the increased collaborative working and regular two-way communication between ourselves and all Self and Health Boards, Welsh Government, GPHC, RPS Wales and GPC Wales that has happened over the last few months. Our working relationships have never been closer. The flexibility to deliver services in ways other than face-to-face, utilising technology in line with pharmacy delivering a healthier Wales, positioning community pharmacy as the first port of call for patients, advancing and growing the use of repeat dispensing, and finally the ability to agree things quickly at a national level. The crisis has shown us that all of these things are actually possible and achievable with the will and the imagination. So what about the baggage that we'd like to see the back of? Paper prescriptions must be at the top of that list. The need to resolve reliance on paper prescription and move to an electronic solution. We also need to move away from the bureaucracy for the sake of it, which means that where we've currently stopped significant amounts of our contract requirements, including audits and patient surveys, we should only restart those elements that have a clear patient benefit. These last few weeks have made me incredibly proud to be a community pharmacist in Wales. To me, the crisis has highlighted that despite being a relatively small network of 715 community pharmacies, it is a network with a big heart.